Okay, welcome everyone. As you can see, I am not Sarah. I'm filling in for Sarah today. My name is Breanne Steele. I also work at the ISD. I support the adult ed programs in Macomb County, and then I just started also supporting CTE education. So I'm super excited to be more involved and work with Sarah a little more, as well as Shannon Williams, if you know Shannon. We are here to talk about careers in medical laboratory sciences. I'm going to turn it over to Dawn Taylor. We are recording this for future reference. And then at the end, whenever Dawn's done, we'll have time for questions and then I'll share the password. So I will turn it over to Dawn.
Thank you, Breanne. And thank you, everyone, for the invitation to speak to you today. My topic is Pathways to Impact, exploring careers in the medical laboratory sciences. And in my profession, I find these types of collaborative groups where we learn together to be so valuable. And so the opportunity to share with you is much appreciated. My slide's not going forward. Hold on here. Okay. All right. Well, my name is Dawn Taylor, and as I said, I'm a medical laboratory scientist. I'm a former laboratory educator. Currently, I'm in workforce development, serving as recruitment liaison for joint venture hospital laboratories. JVHL is a network of 120 hospital laboratories throughout Michigan, Ohio, and Indiana. My goal over the next 40 minutes or so is to provide you with an understanding of the essential impact medical laboratory professionals have on healthcare and the growing demand in the field. I'll outline the diverse career opportunities available to students and describe the education pathways to achieve them. We'll have hopefully some time for question and answer too. I'd really like to know what your understanding is of medical laboratory science and what you think the interest level of your students would be. So I look forward to hearing from you as well. So to learn a little bit about the medical laboratory's impact on healthcare, the goal of every medical laboratory is to produce accurate and timely data in the care of all patients, from the very youngest to the eldest in our society. The data produced are crucial for healthcare delivery. For example, the flow of patients in a hospital emergency room or the OR are inextricably linked to data produced in its laboratory. Without a fully functioning laboratory, a hospital would need to divert patients from their ER and cancel surgeries. So it's that critical. We play that critical of a role. Effective laboratory data are necessary for effective emergency response, whether it's a public health emergency impacting the globe, such as COVID, or a localized outbreak of foodborne illness. Laboratory tests are necessary to ensure that the response is timely and effective in order to ensure the health and safety of our society. Public health monitoring is another aspect that is dependent upon laboratory testing. The recent COVID pandemic is a prime example. Medical laboratory professionals were involved at various levels during the pandemic, developing new tests to understand our response to the COVID pandemic. And then currently, they're still involved in testing wastewater for COVID surveillance as well as other infectious diseases. So within the public health sphere, medical laboratory professionals play an important role. And this next statistic is really pretty telling. The data from laboratory tests inform 70% of all clinical decisions made in a healthcare setting, including those of us who go for health screening and assessments, when we have an illness that needs to be diagnosed, when we have treatment decisions that need to be made, or if we have a disease, a chronic disease like diabetes or heart disease, and those types of disease management decisions are made based on a laboratory test. we produce life-saving data every single day. This was brought home to me when an acquaintance of mine who was 35 weeks pregnant ended up in the emergency room one Sunday afternoon, not feeling well. She had been recovering from a viral illness and just didn't feel right. Called her doctor, and the doctor said, well, let's have you go to the ER. We'll put the baby on a monitor. We'll make sure everything is okay. Well, they took her up to the OB area, put the baby on a monitor. Everything was fine. She was expecting to go home, just thinking that, you know, she's still tired from her recent illness. Well, that afternoon, there was an astute medical laboratory scientist working in the hematology lab that noticed a few unusual cells when analyzing her blood film. And those cells were immature white blood cells. Ultimately, that screening tool led to my friend's diagnosis, unfortunately, with acute myelogenous leukemia. I'm happy to say that she delivered a healthy baby early and went through chemotherapy and is cancer-free after several years, and went on even to have a fifth child. So her good outcome can be attributed in some fashion to the astute medical laboratory scientist who found those rogue cells that Sunday afternoon, which set her on a journey that certainly she didn't want to be on, but she's grateful that her outcome was positive because they caught it early enough. So that's an example of how a medical laboratory professional can save a life every day, and in this case, the life of mom and baby. Who are medical laboratory professionals? Well, we're a diverse group of scientists with diverse interests. It's not a one-size-fits-all profession, and so there are lots of opportunities for growth, opportunities for young people who are considering this field to think through what they really enjoy and different aspects of the career that they can get involved in and become subject matter experts. We are vital healthcare detectives, as the example I just gave described. We're guardians of health and wellness, and so the data that we provide helps us all stay healthy. You know, many of us, go for our annual physical and we wait for those laboratory results to come back to tell us, oh, is my doctor going to know that I've been cheating on my low-fat diet? Are my numbers going to reflect that? So we help society stay healthy. And then we're champions of quality health care. One of the aspects of medical laboratory science is our attention to detail and making sure that the results that we put out are accurate, because we know that the health of our patients depend on it. So our health tomorrow depends on pathologists and laboratory professionals who make an impact today. And so that is why it's so important for us to share this message with young people who like science and want to help people to know that there is this profession out there that can be very rewarding for them and is very necessary for the health of society. Where do medical laboratory professionals work? Well, again, in a variety of environments. Clinical laboratories are, present themselves in all sizes and settings, ranging from small physician office laboratories to large reference laboratories, commercial labs, independent practices, academic medical centers, and hospitals. And so depending on, your makeup and the type of environment you want to work in, there is a place for anyone who enjoys science and wants to work. So you can see this slide, the hospitals, independent reference labs. I talked about the public health component, also forensic laboratories, veterinary clinics, and certainly in research, medical biotech and industry are large, they employ medical lab professionals in large numbers. So again, you can see the diversity of environments where we work. Characteristics of laboratory professionals. They were typically we have a strong science interest in science. Biology and chemistry are the basis with which we propel ourselves forward to become a laboratory scientist, and that passionate desire to help people. When I was a program director for a laboratory education program, when I would admit students at nearly every interview, why are you considering this career? Why do you want to be a part of our internship? And they have this desire to help people within healthcare. And I like to describe it as it's where science and healthcare meet in the medical laboratory. Typically, we like to enjoy solving problems, puzzles. We don't shrink back from things that are difficult to figure out. We thrive with challenge and responsibility. We tend to be self-motivated and detail-oriented. We have an affinity, don't shrink away from computers and technology, for that's a very big part of the work that we do. We work with sophisticated equipment. We're successful working independently and on a team. I showed you how important the laboratory is to the overall healthcare team. So we need to be able to converse with providers, with nurses, with other healthcare professionals on a regular basis. And also we need to be able to work independently. Displaying a perseverance to find the right answer. So that stick-to-itness to keep going to find the answer rather than give up is a characteristic of a successful laboratory professional. And then being able to adapt quickly in high pressure situations. And so that last characteristic is somewhat variable in terms of the type of environment that the person would work in. And so if they don't like to work in high pressure situations, such as a blood bank in a busy trauma center, then maybe that role wouldn't be the best for them, but there are many other roles that would fit and would be a satisfying career. So again, the profession has a lot to offer. So I'm bringing forward college and career readiness software platforms. I know that you all know much more about these than I do. I'm bringing them forward for one reason, and that is I am learning in my role currently that they play an important part in the students' research of different careers. And I just want to bring forward the fact that our medical laboratory professional organizations are working with these organizations in order to update and provide accurate resources to portray the medical lab profession, in its truest sense. Many of these rely on data that they get from the Department of Labor, the Bureau of Labor Statistics. And if you do a search there, you will find information about clinical laboratory, medical laboratory. They use interchangeable terms, but some of the material there is not as accurate as we would like it to be. And so we're working to get that updated. We're working with these platforms to make sure that the information that the students receive is accurate. One example of an inaccuracy is that for 2-year and 4-year degreed roles within the laboratory, those are rolled up into just a generic job role. And so consequently, the rate of pay, the salary information that's included there is arbitrarily low because it takes into account the 2-year people and the 4-year people together. So that's one example of an inaccuracy that sometimes can make the profession not as attractive to students that are looking into it. So I'll talk about Zello. The reason I chose Zello is because I understand that it's accessible by many Michigan school districts. So it's based on John Holland's theory of career development. And a little bit about me, I do have a graduate degree in counseling. So I remember studying John Holland's theory when I had my career counseling class. And so this took me back to that course. And their product is based on the personality types that are applied to career interest. And John Holland described them as realistic, investigative, and so forth that you see there. The Zello product takes and uses different terms to make it more attainable to or understandable to students that would be using them. And so I've highlighted in yellow the 3 that are classic ones that the student would necessarily, these students would be attracted to medical laboratory careers. And so builder, thinker, organizer. So they like to create things. They're good critical thinkers. They're organized. They're able to follow a standard operating procedure, which is critical to the work that we do. However, social or helper isn't necessarily always, doesn't always come up when the student does these types of profiles. And I just want to bring this forward because, like everything, there's not just one particular personality type that's going to say that the student is going to love this career or this student's going to love this. There's these things are help, they're a help, but they're not the be all and end all to help determine the student's satisfaction with a particular career. The social helper aspect I see in so many of my colleagues, particularly those of us who have gone into education and into leadership roles. We, enjoy the interaction with others. We enjoy knowing that we're helping our patients, even if we don't see them face to face. And so having a student that loves science and wants to help people, I think, pointing them in this direction to take a look at medical lab science and try to get them opportunities to maybe shadow in a laboratory would be a good perspective for you as a counselor, providing information to your students. A little bit about the future, our outlook and data projections. We have over 13.2 billion, closer to 14 billion tests performed annually in the United States, which is a huge number. That number of tests that are available, so the different types of tests, has grown to nearly 62,000 FDA cleared and approved laboratory tests. So the FDA, Food and Drug Administration, is responsible for validating and approving any laboratory tests that is able to be performed on patients. The number of those tests has grown 384% in the last 30 years, and so this growth is expected to continue. Most of this growth is in an area known as molecular diagnostics. It continues to be a high growth area and one of great interest for young people coming into the field. We currently have just under 345,000 medical laboratory professionals, and these individuals are only those that are practicing with an associate's or bachelor's degree. They're currently working in the U.S. That number is much greater when you think about the master's or doctorate level individuals that are working in the field. So here's the next statistic that's really important to us. The Bureau of Labor Statistics estimates that there will be a 5% increase in the number of medical lab professionals needed in the next now 9 years, 8-9 years. That's about 2,000 annually. That 5% increase is on par with most other professions. And so as we think about the population aging, we typically, as we age, we need more laboratory tests. And so the number of tests being performed per year is likely to go up, and the need for professionals to run those tests is expected to grow. So the next bullet, natural attrition, is estimated at 8,000 annually due to retirements. So 8,000 plus 2,000 is, we figure that we need 10,000 new professionals every year. Our current programs produce less than 7,000. And that number is actually probably a little bit lower, probably closer to 5,500, because there's a certain number of the 7,000 that graduate with a 4-year degree who were already working in the profession as a 2-year graduate and now are being promoted. And so that's the difference there. So we anticipate that the deficit is at least 3,000. It could be closer to 4,500 every year. And so that is significant when you think about, 10 years out, what that means for our profession of 345,000 to be short 40-some thousand people over a course of several years. It's pretty staggering. So all that to say, there are growth opportunities. There's job security in this role for a student who is considering this and is inclined to apply their love of science to a healthcare role such as this. I'm going to talk now about the different aspects of the laboratory. So we have clinical pathology, and clinical pathology focuses on the analysis of blood, body fluids, and other specimens, providing crucial data used for the purposes I've described earlier. This graphic shows a really strong career ladder available to individuals considering the profession, including entry points that require a certificate or a training program, such as phlebotomy, and that is an on-ramp to a career ladder that could lead someone all the way up to medical school and being, lead to physician leadership, which is called a pathologist. So the physicians in the laboratory are called pathologists. Phlebotomy and medical assisting, you can see the bottom rung of this ladder. Phlebotomy requires typically a training course and some successful draws. Some of the high schools are teaching phlebotomy in their career technical areas. And Brianne, I'd love to talk with you at some point about your role there at the ISD. And then medical lab assisting is also something that school districts are starting to add in addition to phlebotomy. Medical lab assisting skills are things like specimen processing, prepping the samples for the medical lab scientists to test. Those are all typically on the job trained roles. And so these are entry points that students can explore the field, work in the field while they're determining whether they want to go on for a college degree in medical laboratory science. So what are the roles available in the profession and what are the education pathways to achieve them? I'm going to go through each of them here. I mentioned phlebotomists. I think we all know they're the ones who collect and prepare the blood samples, and they are responsible for communicating with patients. They're really the ambassadors of the laboratory with the patients. And so many times if I tell someone I'm a medical lab scientist, they say, oh, you draw blood, because they equate that task with, their blood tests. And so while phlebotomy is a part of a medical lab scientist training, most of the phlebotomy that goes on is done by a specialized phlebotomist who does that on a regular basis, and it has honed their skill. Skills and traits for this, they need to be able to work directly with patients and show compassion, be a good communicator, work with a high level of accuracy. No one wants to get stuck twice because someone didn't draw the right tube, and so attention to detail is really important. As I mentioned earlier, the education pathway for this is high school graduate or equivalent and completion of a phlebotomy training program. And training programs typically have these aspects to them. They teach the anatomy of the circulatory system, specimen collection techniques, how to process and transport those specimens, and then laboratory quality assurance principles as well as safety. Next on the ladder is a medical lab assistant, and I mentioned that they ensure that each specimen is appropriate for testing. Some of our larger laboratories can do, upwards of 13 million tests per year, the lab I worked in. And so you can think about how many tubes of blood does that equate to, and what are the what's the potential for error with those specimens. And so this is where the medical laboratory assistant role is really important, because they're the watchdogs of the specimens that come into the laboratory. They check to make sure that the tests are ordered correctly. They maintain equipment and work area. They transport the samples and load them onto the instruments in some cases. Skills and traits for this role would be aptitude for computers and technology, good analytical skills, attention to detail, and a good communication skills. And as I mentioned earlier, the pathway would be high school graduate or equivalent and completion of a medical lab assistant training program. There are some community colleges in the area that offer this, or like I said, many labs will take a bright high school graduate and give them on-the-job training for this role. It is a great precursor to a more technical role, such as medical laboratory technician or MLT. And so that person is responsible for not only collecting and processing the samples, but they're going to actually perform the test, and they're going to get the test results and assess the validity of those results. They're also responsible for quality assurance data. There's a lot that goes on in the laboratory to make sure that the results reflect quality and accuracy in a timely manner. And so the MLT is responsible for that. They may work under the supervision of a medical lab scientist, and they do have responsibility to put out accurate test results. So again, skills and traits, display attention to detail, good communicator. They need to be able to problem solve. You know, these instruments sometimes cause problems. There's problems with specimen collection, so they need to be able to communicate with others in the hospital setting and solve problems. And then, you know, they are responsible for the results that they put out, and so treating each specimen like it's their own family member specimen, and using ethical behavior in their reporting processes is very important. So the education pathway here is an associate's degree and completion of an accredited medical lab technology program, and then certification. So the next step for this role is, after you have your education and you complete an accredited medical lab science technology program where you actually have clock hours in a hospital laboratory called an internship, then you sit for a certification exam. ASCP is one option. There are a couple of others, but certification is necessary for most hospitals to consider hiring an individual at this level. So the next role is medical laboratory scientist, and they do pretty much everything a medical laboratory technician will do. In addition, they have higher level complexity, higher level responsibility in terms of analyzing quality assurance data. They may direct, you know, laboratory resources and operations. They may teach and supervise others. They may also develop new tests. And so in addition to doing the basic testing, they do more complex tests on blood and body fluid. And again, the skills and traits are all very similar to what we just talked about. Critical thinking is very important with this role as well. The education pathway is a bachelor's degree and completion of an accredited medical lab science program and certification as a medical lab scientist, again, ASCP or other. And so medical laboratory science, the four-year degree, is really a basis for a variety of different roles that, you know, could be played in a hospital setting, in public health, and so forth. You can go on to leadership roles, teaching in an academic setting, so many opportunities. I know of medical laboratory scientists that are teaching in CTE programs in high schools in the state, and so I applaud them for choosing this career path as well to raise up the next generation of professionals. Next would be a cytogenetic technologist. This is a specialty role. Again, they are working with blood or tissue samples, and their focus is to analyze chromosomes within a patient's cells and identify abnormalities in number or structure. And so again, attention to detail is important here. There's a lot of microscopic work involved with this role. They need to enjoy independent work and thriving in high responsibility situations. These are, you know, obviously have grave consequences for patients. they're diagnosed with something, and so it's important that this is highly accurate. And then good communication skills, because they're communicating with physicians and other caregivers regularly. The education pathway for this role is a bachelor's degree and/or a master's degree. Some programs are now at the master's level as a terminal degree. Completion of an accredited cytogenetics program. And so what I mean there would be a hospital or a cytogenetics lab internship, and then certification again as a cytogenetic technologist. So that sums up the roles within the clinical lab. What I'm going to do now is talk about the different departments in a clinical lab. So if you are a medical lab technician, so at the 2-year level, or a medical lab scientist at the 4-year level, you could work as a generalist, which means you could float between many of these different departments that I'm going to share. One is immunohematology or transfusion services, also known as the blood bank. And blood banks are critical to hospital operations. They maintain a safe and reliable supply of blood products, which are available when needed. They may actually collect units of blood if they have an autologous program in their hospitals. They'll test it for infectious diseases. They'll separate the units into different components and store it under safe and controlled conditions. Medical laboratory professionals will then match donated blood products with recipient patient blood, assessing the compatibility to ensure safe transfusions. So this is a very, very important part. This is an interesting department. It's one that hums along very nicely until there is a trauma or something that comes into the ER, and then the routine work gets set aside for a while, and while they maintain and process whatever units of blood are needed to save that person that came into the emergency room in a crisis. So again, ability to adapt is important in this department above all. Hematology, medical lab professionals working in hematology perform testing that's focused on identifying diseases of blood and blood components, including anemia, leukemias, infection, blood clotting disorders. The example I gave earlier, that medical lab scientist was working in the hematology laboratory when she noted those immature blast cells for that patient. The microbiology department. So if you've ever had an infection of any kind, a microbiology medical lab scientist in that department would have been integral in identifying the organism, and also to test that organism against antibiotics to let the physician know the best course of treatment. And so there is a lot of manual work done in this department. It's very interesting. You see the plate in the picture here. You'll get a plate with a variety of different organisms on it, and learning to identify or work up the organisms that are likely pathogens and separate those from ones that are normal organisms that you would find in our bodies. And so that really takes a lot of technique and skill to do that. And it's very interesting. I'm biased because I work in this department for many years, and it's like solving a puzzle, being a detective every time you pick up a patient sample. This lab is instrumental in helping to prevent the spread of infectious disease within a hospital or within a community, and they consult regularly with physicians on patient care. Very interesting. Molecular pathology is the study of diseases at a molecular level. They use sophisticated equipment to precisely analyze genetic and molecular data to diagnose disease and/or guide prevention and treatment. This is the area that I mentioned earlier where there is a lot of growth in testing. Toxicology refers to testing of chemicals, drugs, toxins that may affect patients. It's where those are identified. Sometimes toxicology labs are separate laboratories, and individuals can become like subject matter experts in this area and focus all of their knowledge and future study in this area. And then some of the larger health system laboratories have their own toxicology departments. And so you can work within a hospital laboratory and have that specialty training in toxicology. Chemistry is the workhorse of the hospital laboratory. Nearly every patient that comes in, even those that go to their doctor's office, have some type of chemistry test. They perform a wide variety of both routine and stat analysis of urine, serum, spinal fluid, other body fluids, and the data produced from these tests are critical to diagnostic pathways. And so chemistry laboratories are very busy. Typically in a large laboratory, you would have a robotic track that would process samples, and the medical lab scientists would then be responsible for analyzing the results and analyzing the quality assurance data that are produced by these automated systems to make sure that the results that we're putting out are accurate. Cytogenetics, cytogenetic technologists, as I mentioned earlier, identify normal and abnormal chromosomes. Again, this is attention to detail. It's microscopic work. This is important to not only to diagnose genetic disorders, but also certain cancers. So another laboratory specialty, everything I covered so far was under the umbrella of clinical pathology. The other specialty is anatomic pathology. And in AP labs, teams are processing, cutting, and staining tissue samples. So if you have a biopsy of some kind, tissue removed or an organ removed, those samples of the organ or the tissue are cultivated and processed so that the pathologist can read the slide and diagnose cancers. And so this is normal skin cells that you see on the slide here, and that they've been stained, and the pathologist then could look at that and determine if there was a type of cancer starting to form in that skin biopsy. So they're diagnosing not only cancers, infections, and other diseases. They do that through macroscopic, microscopic, and molecular methods. There's also a promising career ladder in the anatomic specialty as well. So you see, we're not dealing with blood, so we don't have phlebotomy at the bottom of this career ladder, but we do have laboratory assistant. So much like the medical laboratory assistant, a lab assistant in the anatomic path lab could be on the job trained, and they have a critical role in receiving specimens and processing them and helping to maintain equipment. I'm going to go through the other roles that are on this slide in the next few slides. So histotechnician and histotechnologist are two roles in anatomic pathology, and they're responsible for preparing and processing tiny tissue samples, and they embed them onto microscopic slides and then they get stained, and the stains help to enhance and identify disease markers that are in the cells, and the pathologist is specially trained to identify what those markers mean and help to bring a diagnosis for the patient. So they play a really important role working with the pathologist to develop a quality slide so the pathologist can do their work. So skills and traits, they need to enjoy following standard procedure because there's a protocol that needs to be followed for each of these. Attention to detail, ability to adapt to varying work volumes. Sometimes it's busier than others, and so being able to work accurately and quickly when needed, and then good problem solving skills. Cytologists. They evaluate microscopic slides for the presence of cancer and infection. Examples would be a Pap test, or if you had a fine needle biopsy of some kind. And they really collaborate with pathologists to determine what the next companion diagnostic test would be. So a Pap test is a screening test. So if there were abnormal cells on a Pap smear, then the next step would be to develop or to determine or recommend additional diagnostic testing. And that's done in collaboration with the pathologist. So skills and traits there would be critical thinking, being detail-oriented, again, problem solving. With cytology, the education pathway is bachelor's and/or master's degree and completion of an accredited program. Again, that accredited program has a significant number of clinical hours where they're in laboratories, they're preparing slides and reading slides. Much like the other areas of medicine, there are what's known as physician extenders, so nurse practitioners, physician assistants. In the lab world, we have that as well. We have a pathologist assistant. Remember, I mentioned that the physicians of the laboratory are called pathologists. So they perform surgical and autopsy services under the supervision of the pathologist. They do what I would say gross analysis, so they're describing what the tissue sample or the organ looks like when it is received in the laboratory. They process, they might photograph the body and compose the clinical history of someone who they're performing an autopsy. Again, skills and traits here, attention to detail, interested in dissection techniques, and they are really astute in applying anatomy, physiology, and their knowledge of disease systems to their daily work. And the education pathway here is bachelor's and/or master's degree. I think most are master's degree now. Programs are at the master's level, and completion of an accredited program. There's a mistake on that slide. It's accredited physician assistant program. And then pathologists, they have a critical role. They serve as the link between patients, their doctors, their providers, and the laboratory tests that are put out by the people that work for them. Pathologists typically are the leaders of the laboratory. The medical directors of laboratories are either MD or DO pathologists. They specialize in the study of blood, fluids, and tissues. They could have a specialty on the anatomic side. They could have, additional training and specialize on the clinical side. But mostly the characteristics would be commitment to study, analytical thinking, communication, and empathy. And the pathway is very similar to other physician pathways. Undergraduate degree. I'll stop here at undergraduate degree and just say that medical laboratory science is a great undergrad degree for any role leading to, or any education pathway leading to becoming a physician. This is important to know, and something I'll explain in a little bit more detail in a few minutes. And then 4 years of medical school, there is path residency that's usually 3 to 4 years. And then typically there can be an optional fellowship. So someone could go through pathology residency and be trained either in clinical or anatomic path or both, and then decide, well, I want to focus on cytology. And so they might do a fellowship in cytology and be a pathologist that specializes in that area. So how to get started? Students should take courses in K-12, science courses in K-12, encourage them to look for shadowing opportunities. After high school, search for opportunities to work as a medical lab assistant or a phlebotomist. If they're planning on another healthcare career like nursing or med school, starting out as a phlebotomist to gain experience working directly with patients is a good way to go. And again, consider MLS as a pre-professional undergraduate degree. I say that because the first year of medical school is highly focused on understanding and interpreting laboratory tests. And so if you have that as your undergrad degree rather than biology or pre-med, you're really ahead of the game in med school. And nearly all the courses that you're required to take in order to apply for med school are those that are part of the medical lab science undergraduate degree anyway. So it's worth looking into and advising your students that way. Key coursework, again, strong background, biology, chemistry, and math, an undergraduate degree, either 2 or 4 years. Clinical laboratory internships are a part of all of the pathways that I mentioned. So you need to spend time in a laboratory working side by side with professionals in the field. And it's a blend of theoretical coursework with hands-on clinical practice. That formula leads to the best opportunities. And then the graduates come out with knowledge of human biology, disease mechanisms, and lab techniques, and they also receive training with sophisticated equipment and learn to analyze complex clinical data. We have advanced opportunities, master's and doctoral degrees that I already mentioned. This next slide, I have put together resources for you and for your students. There are many videos listed here, and this website, What's My Next? I put in the QR code here. That is going to take you to our professional organization where you're going to have a lot of opportunity to see videos, to study each of these roles in more detail. So it's a great resource for your students if they want to find out more about the different roles. So I will, before I open it up to questions, this slide is an opportunity to connect with me. This QR code will take you to a form that you can fill out if you would like to learn more, if you want to have a conversation directly with me, if you want to schedule a career presentation in your school, or you want a digital portfolio of more information, you can use this QR code and connect directly with me, and I will follow up with you. And I also have listed some of my references for your review if you're interested in learning more. So at this time, I'd like to open it up to questions if there are any.
And feel free to unmute yourself, or you can throw it in the chat. Dawn, thank you. We didn't have any questions during the presentation. Catherine just really shared that the story you shared at the beginning of the presentation really resonated with her because she had a similar experience. But we do have time. Anybody have any questions for Dawn?
Would anybody be willing to share a takeaway? What didn't you know at the beginning of this that maybe you'll take away to share with your students?
Someone just shared they did not know the extent of what's available. Other takeaways.